Well, hello everyone. In today's video, we're going to talk about the pros and cons of a Medicare supplement plan, one of my favorite subjects, right? So before we could talk about the pros and cons of a Medicare supplement plan, I like to just touch base on what is Original Medicare. It's like, why do you need a supplement plan in the first place? It makes sense to go over Original Medicare first, right? So Original Medicare is health insurance regulated by the government for individuals turning 65, or if you got a disability and you qualify for SSDI, you would get Medicare after 24 months. So Medicare is a health insurance program that is earned by you working within the US, working for at least 10 years, 40 quarters, paying Medicare taxes. So that is Original Medicare. A Medicare has two parts. You have your Part A, which is your hospital coverage, and Part B, which is your medical coverage, okay? Medicare, Original Medicare covers 80%, leaving you behind 20%. And what a Medicare supplement plan would do would cover that 20%. So let's get right into it, okay? So like I said, a supplement plan will cover that 20%. Before we go over pros and cons, I want to talk about supplements in a whole as far as like different companies. These plans are given by private health insurance companies. They're standardized by the government, right? So they follow Original Medicare. They pay that 20%. So it's very important to work with a broker that understands the market, understands these different health insurance companies, because you never want to get on a Medicare supplement plan and follow the shiny object. So what is the shiny object? It's a low monthly premium plan with a company that is pretty new in the market, that is not really steady in the market. You don't want to do that, because what usually happens is these companies will come out in the market and they will attract new individuals to get on their plan based on their low monthly premiums. And then what happens is they jack up the rate when you turn 70 years old or whatever, and you no longer could afford it, or it's just very unbearable or very expensive. So it's very important to work with a broker that understands this and understand the rate history and how stable these insurance carriers are. Unfortunately, this is not public, but we have the information, right? So we have the information, we have the data on showing you what is stable, like what insurance companies are stable, the history of their rate increases. So keep that in mind. So like I said, the Medicare supplement plans are standardized. They all have to do the same thing. The only difference is that monthly premium. Now let's talk about when should you enroll in a Medicare supplement plan, okay? The best time to enroll in a Medicare supplement is when you first are eligible for Medicare, when you first turn 65, or when you retire from work and you're coming off of employer's health insurance coverage, okay? You have 6 months after getting on Medicare Part B to enroll in a Medicare supplement plan. So like I said, it's very important to enroll within that 6 months, because you don't want to have to go through underwriting. Underwriting is when you have a series of questions that you have to answer, and if you say yes to any of these questions, then you can get denied for coverage. You can get denied for a Medicare supplement plan. However, when you first turn 65, or when you first come off of employer's coverage, you have that 6-month window where they won't ask you any health questions, okay? So what are some of these health questions? Parkinson's, dementia, diabetes with complications, congestive heart failure, rheumatoid arthritis, and such. So if you have any of these type of conditions, then you may definitely want to get on a supplement plan when you're first eligible to do so you don't have to worry about underwriting, okay? So these insurance companies cannot deny you coverage. They cannot deny you service if you are making your monthly premium. So once you're on and you're making your monthly premium, then they cannot cut you off. So it's very important to understand that, okay? So let's start with the first pro. Like I said, we're going to do pros and cons with a Medicare supplement. Let's start with pro number one. So pro number one is doctor networks. There is no doctor networks when it comes to a Medicare supplement plan. As long as your doctor accepts Original Medicare and he's accepting new patients, then you can see that doctor, which is really nice, okay? You don't need to ask for a referral or anything like that. All you have to do is call up that doctor and say, do you take Original Medicare? And if they say yes, then they would take your Medicare supplement plan, because all the supplement plan do is follow Original Medicare and pay the 20% that Medicare leaves behind. So that is really nice. That means that you can travel with this plan, okay? Which brings me to pro number two. You could travel with a Medicare supplement plan. You could be in New York for 6 months, California in 6 months, Hawaii in 6 months, Alaska in 6 months, Puerto Rico in 6 months. You can do it all, okay? You can travel. This is perfect for snowbirds, okay? So if your retirement plan is to travel throughout the USA, then yeah, this is the perfect plan for individuals that love to travel, love to see their grandkids, and all of that jazz. So it's really nice that you know that you have that peace of mind when it comes to traveling, when it comes to doctor networks and such. So now let's talk about pro number three. Pro number three is pre or prior authorization. You don't have to worry about that, right? With traditional health insurance, you may have to ask for permission or prior auth or pre-authorization for a test, a lab, a treatment, a surgery. Well, when it comes to a Medicare supplement plan, whatever Original Medicare covers, whatever is in black and white, that Original Medicare already said this is a covered service, guess what? Your Medicare supplement plan will follow and pay that 20%. You don't need to worry about pre-authorization or anything like that. Now, remember, it's based on what Original Medicare covers. So if you need plastic surgery or something like that, of course, that's not going to be covered because Original Medicare doesn't cover that, right? So as long as it's a service that Original Medicare covers, the supplement will kick in and pay that 20%. Now let's talk about the cons. We talked about the pros. Now it's time to talk about the cons, okay? So con number one is going to be cost. Some individuals simply cannot afford a Medicare supplement plan. It's just that simple. Some people cannot afford it, right? So if you can't afford it, then a supplement plan would not be the best option for your situation, unfortunately, okay? So you have your Medicare Part A premium, which is usually $0. You have your Medicare Part B premium, which is under $200 a month. Depending on your income, okay, there is an IRMA chart, and that determines your Part B premium. And you have your Medicare Supplement Plan premium as well. And we cannot forget, we're going to talk about this, your drug premium. So that is a lot of premiums. When you add that up, that can be pretty costly. Now, I would definitely say that certain parts in the world, a Medicare Supplement Plan can be very affordable. In certain parts of the world, not so much, okay? Particularly in Florida, our supplement plans can be a little costly. Why is that, Patricia? Why is that? Because there is so many individuals that live here in Florida. They know that Florida is that retirement state, that sweet retirement spot state, right? So the plans here cost more because a lot more beneficiaries live here in Florida. A lot of individuals retire here in Florida. So the premiums here is a little more, okay? But like I said, in certain parts of the country, the supplement plan can be very affordable. So that con may not be a con for you. All right, let's talk about con number two. And we're going to talk about services covered. This is a con because, like I said, a supplement plan follows Original Medicare. So if Medicare does not cover a service, then it's not going to be covered under a Medicare supplement plan, such as dental, vision, and hearing. Now, some supplement plans may add a rider. You may add a rider, meaning that you could add some extra stuff such as dental, vision, and hearing discounts, but not dental and vision hearing benefits, okay? So most cases, you're not gonna have any type of coverage or any help when it comes to dental, vision, and hearing. You have to get a standalone plan. So maybe that's not a con for you if you could afford a standalone plan, but that is a con, right? Because yeah, you're not gonna have these extra benefits when it comes to a Medicare supplement plan. Con number three, okay? Con number three is prescription drug coverage. Original Medicare does not cover prescription drug coverage, so you need a standalone drug plan, also known as Medicare Part D. Now, people always ask me, what if I'm not taking any medications? I'm a healthy 65-year-old, okay? What if I'm not taking any medications? If you don't have TRICARE for life, if you don't have VA coverage or employer's coverage, then you do need to enroll in a standalone drug plan. Not my rules. This is the government rules, okay? I'm just giving you what the rules are. If you decide to not enroll in a drug plan, what will happen is when you need to get on medications, you will be penalized for every single month for not enrolling in a drug plan on time when you first were eligible to do so, when you was first eligible for Medicare Part B. So please don't make that mistake. Don't be that person that decides, I don't want a drug plan because I'm not on any medications. There are several drug plans out there that is low monthly premium or even $0 monthly premium if you're not taking any medication. So it's best to just get on an affordable drug plan, and when you are taking medications, then pick the drug plan that best fits your particular needs. But like I said, if you're not on any medications, just take that $0 drug plan or that low premium drug plan because they are out there. So just get on a drug plan to be safe and not to worry about penalties and all of that jazz, because unfortunately that penalty is there for the remaining of your life as long as you are on a drug plan. So that is the third con, that you do need a standalone drug plan when it comes to a Medicare supplement. So I want to know in the comment section below, what do you think about the pros and cons of a Medicare supplement plan? What did you learn in today's video? If you have any questions, leave them in the comment section below. I'd be more than happy to answer your question. And if you know someone that needs this information, definitely share this video with a friend. If you're not subscribed to the channel, definitely subscribe to see me again. Thank you so much for watching today's video. If you need any assistance with any of this information, give our office a call. We charge nothing for our services. We'll be more than happy to help. Thank you so much for watching, and I'll see you on the next video. Bye.